Okay, thank you very much for joining us again, Caroline, for a second Q&A session. And before we start, I thought I would just say thank you to everyone for all of the feedback we received after the last session. That was really encouraging for us to hear that. It was also pretty clear from that feedback and the number of additional questions that we've had that there's an appetite for people to hear for this type of Q&A, and you've been very good about making sure you set time aside to do it again, and you've even suggested we make it a regular fixture, so we'll do that. One of the things people were really keen on last time around was that it wasn't scripted at all and that we continued to do it in that vein. It's also pretty clear that people liked that we didn't share the questions with you in advance, so we'll also keep doing that. I think it's also only fair to Caroline just now that I point out again that she cannot possibly know all of the specific details on all of the answers, but where she doesn't, she will get people the answers they need from her wider team. As hopefully people have seen in the brief today, we will publish those expanded and more detailed answers alongside the next Q&A session each time. So before we get into the submitted questions, we finished the last Q&A hearing a bit more about you as a person and some things about your home life, which I know people really liked from the feedback. People may remember that at the end, you were asked how many hours sleep you got at the moment. So I thought this time around, it might be an idea to start by asking, what is it that gets you up in the morning? Essentially, what chief executive, and just as importantly, what is it that you care most about as Caroline?
So we're starting with an easy one then, Mike. Thank you. Nice to see you again. And yeah, I'm looking forward to round two of this, and I'm delighted that people like the fact that I haven't seen the questions. I'm not sure I do. Anyway, I'll do my best. So what gets me up in the morning, and what motivates me, I presume, to do what I do. So I think the most straightforward way to answer that is about trying to make a difference, Mike, and trying to make a difference in an organisation and in public service that I have invested my life in as a nurse and as a leader, and knowing how important it is to get it right when we provide care. Doesn't matter what setting that's in. And most importantly, to do that well, how we need to support our colleagues that are doing that day in, day out when it's really, really tough. So yeah, what gets me up in the morning is to make a difference, and that difference is focused around how people experience NHS Grampian when they come to work here, or how they experience it when they're in receipt of care from NHS Grampian colleagues.
Okay, thank you, Caroline. And we'll get on to the first submitted question. This was, well, a few different staff members have asked this, some of whom wanted to remain anonymous, but one of them was Denise Forrest. She's asked if you could provide any clarity over whether NHS Grampian staff would be given the Queen's Platinum Jubilee in June as a public holiday. Are you aware of where discussions are about that, and is it something that maybe you'd support in principle yourself?
Yeah, so Mike, I've definitely been cited on conversations around whether or not there will be an additional public holiday across the public sector, the NHS public sector in Scotland. I don't have a definitive answer, but I think that's because a definitive decision hasn't been made yet nationally. So there will be a celebration of the Jubilee, and for obvious reasons that I'm sure, sorry, who was it that asked the question?
Sorry, I was muted there, classic mistake. It was Denise Forrest.
Denise. So as I'm sure Denise will appreciate, this wouldn't be an individual board decision at the moment. So we are awaiting, as fact, the last time I was involved in a conversation around this, which might have been a month or so ago, we're awaiting a decision from Scottish Government around whether or not there will be an additional public holiday on top of the public holidays that we already have in NHS Scotland. I know that our employee director, Rachel Little, has been involved in conversations, as our Director of People and Culture, Tom Power, will have been as well, through the National Workforce Leads. So we should get that information, and as soon as we get that, we will share that. Of course, in principle, I would want to support well, in principle, I'd want to support much more than a day's additional annual leave, in particular, just now when things have been so tough for so long. That's not within my gift, even as the chief exec, despite what people think. But yeah, in principle, I would be very supportive. And as soon as we get that confirmation from Scottish Government, we will communicate that to colleagues across the system.
Okay, thank you very much. The next question is from Tracey Macbeth, and that's on the subject of TURAS. She's asked if organisationally we could look at providing protected time for TURAS learning for further staff groups. She's flagged up the examples of healthcare support workers who she says say they're finding it really difficult, or in fact sometimes next to impossible, to get the time and, just as importantly, dedicated access to a computer to complete the mandatory training. Is that something we could consider as an organisation? I suppose not just for healthcare support workers, but for other staff groups who need it as well.
Yeah, thanks, Tracey. A really important question. And I think I touched on some of this in my last Q&A around the importance of being recognised as an organisation that supports everyone to develop. And obviously there's different levels of development that individuals want and individuals need. So it's my understanding that for statutory and mandatory training, there is an obligation. If we as an organisation need you to have particular skills or to have demonstrated you've undertaken particular modules of education that would be considered statutory and mandatory, then we absolutely should be creating the time for you to do that. In practice, I know that that is really, really difficult. So where we are now and where we want to be is, I think, two different places. And I would imagine that where it is possible and where colleagues can be scheduled and have planned time to do their statutory and mandatory training, and I'm focusing in on that as opposed to broader continuing professional development. But where it's possible, I would hope that that is happening. That's certainly the policy intent that we have in Grampian. Where it's not happening, I would imagine that's either become custom and practice, or it's too difficult to do because of the workforce challenges that we've spoken about. So I think going forward, and certainly in the cultural work that we're doing, and the work and the conversations that I'm having around how do we attract people to come into the organisation and how do we retain people, then making sure there is fairness across all the different communities in our workforce. Healthcare support workers would be one. So what is good for one should be good, should be applied and good for other people. Or actually, people might need slightly different things to meet their needs. But it should be fair, it should be consistent, and we should definitely be prioritising education and development, because again, that is what is going to lead to better patient care and support services around patient care. So we should already be doing it, Tracey. I recognise that we won't be doing it consistently, and really keen to work, particularly because you mentioned healthcare support workers, and I'm not sure what Tracey does, but to work through the associate practice educators around how we can understand what they're experiencing and how we make that better.
You again, Caroline.
Mike, my lab is rolling about on the chair next to me, just in case there's some strange noises that people think is me.
I did hear that, actually, yes.
Sorry.
To know. Okay, the next question is from Leanne Kitchener, who is a senior charge nurse at ARI. She's been in touch to ask whether there are any plans to pay part-time staff overtime enhancements if they work above their contracted hours. Leanne says she feels our large cohort of part-time staff would be more likely to work additional hours, especially during this really busy spell, if they were paid that overtime. She also mentions that some nurses from her area of work work for nursing agencies on their day off, basically because the agency rate of pay is much higher.
Mike and Leanne, this is a really difficult a difficult circle to square, or square to circle. I don't know how best to say that. This has been discussed pretty frequently at the level of national workforce directors and national chief execs, and there are different schools of thought around it. And I recognise the importance not just of pay, but the importance of, again, back to fairness. Fairness is a big thing. So why would you pay one staff group or one group of colleagues an enhanced rate and not another? So the discussion and the very valid question that Leanne raises, particularly around should we pay part-time staff overtime as opposed to additional hours, is a really live and hot topic. We are bound by national terms and conditions relating to agenda for change, so it would have to be a national decision. That's the first important thing to say. And the two schools of thought that I have heard is absolutely. Why would we not do that for the reasons that Leanne points out? And the other school of thought is, would that then create an unintended consequence of staff who are being paid to do their full-time role, and they end up getting a different end of month salary than those who work part-time and get enhanced rates for working up to 37.5 hours. I think this is a really tricky one. I think the point about agency staff as well is really tricky. So there are some really important principles around trying to make sure that we focus on supporting our substantive staff, and where we do have, obviously we work within finite budgets, so is spending that money on agency and other supplementary staff the best use of our budgets, or would we be better investing in our substantive and local staff? And of course the latter in principle is true, but if you don't have those local staff and we need to be using agency staff, then I can absolutely see why it becomes really difficult when you're working in a team with substantive colleagues, bank colleagues, agency colleagues, to think, is this fair, and why would we not just increase pay rates? So really valid question, definitely not a straightforward answer. And that was Ollie. If we want to, I think we need to continue to have those national discussions around national T's and C's, and we will definitely try to make sure that we have the principles, not just me as chief execs, but as workforce directors, as employee directors, make sure we maintain the principles of doing the right thing. But I absolutely recognise and understand why Leanne's asking that question.
Yeah, I suppose it's reassuring to hear that it's at least on the agenda and actively being discussed at the moment. Okay, so the next one is an anonymous question from one of our physio team, who would like to know when rehab space, which she mentions was reduced while we were operating under critical and essential services, when that will be made available again. She goes on to quite rightly point out the importance of patients and their right to rehab in their recovery journey, and she says she feels frustrated that she isn't able to perhaps offer the level of service she would like because of these space restrictions.
So I absolutely agree. Rehab is a core part of how we make sure that people maintain their and recover to a level of independence and maintain their quality of life. So I think our therapists in particular are quite rightly very focused on making sure there's a balance of all the different services that they provide, and rehab is without doubt critical in that. I'm not actually sure, Mike, of where the areas that where rehab is undertaken have been reduced. Clearly they have been, but I'm not sure where specifically they are. However, I am aware that we have had the support of our allied health professionals in delivering things like fundamentals of care. So they will have been doing other things other than their core roles around rehab. So my answer to when can we get back to that, I can't give a definitive answer. It will be as soon as we possibly can in regards to whatever the space is being used for. And as I say, I don't have the detail in that. And perhaps if we have colleagues' contact details, we could pick this up. What I do know is that in our conversations around the executive team and our leaders across the system, an acknowledgement of if we don't continue to undertake rehabilitation effectively, then we will come up against other consequences that will have a detrimental impact on patients and their families. So it is really important. I hope, like I do with all other services, that we start to get back to service delivery models that people can feel as if they are adding most value, because that's also really important as well. And obviously we are in nearly the end of January, beginning of February, and winter is always a tough time. So I would hope that coming into spring, we will be in a place to do that. But specifically relating to this question, I wonder if we could follow that up with a bit more of a definitive answer if we get the details.
Yeah, I can make sure you get those. Okay, Caroline, so the next question is a little bit of a follow-on from the last Q&A session, where you obviously talked quite a lot about the pressures staff are under at the moment. The colleagues said, what exactly are the actions that are being taken to retain more staff? She feels that we could have maybe been clearer about that in our last discussion. She's also gone on to ask specifically if there are contracts out for long-term agency, how long military medics are here, and what's been done to try and gain more staff, perhaps from outside of Grampian.
Thanks, Mike. Okay, so I think this is a really big question, and maybe there's some more detail that we could pick up in a different session with Tom Power, our Director of People and Culture. It might be a whole session in itself, if that would be useful, because I think it's really, really important for colleagues, and I think that because I get asked this question all the time, recruitment, retention, and sourcing people to come and work in Grampian is a really important topic. So I think I'll start off by saying I absolutely do not have and shouldn't have the finite detail of what at a local level different areas are doing to recruit and attract staff. So what I can say is that it is a daily, if not hourly, conversation about our workforce being our greatest asset, and how can we make sure that we have the right people. And we all recognise and understand the challenge with vacancies, not just in NHS Grampian, actually in the North East. However, some of the things that I can be really clear about at a strategic level, I'm going to split the question up, because what you described there was retention, but then what you went on to ask was about recruitment, and they are two very, very different things, obviously. So retention, keeping hold of the fantastic staff that we have, is really, really important. And the most important thing that I understand makes a difference is how people are made to feel when they come to work, and how valued they are by their organisation and by their teams and colleagues that they work with. Good example of that would be the therapist that mentioned not being able to do rehab. That's why therapists come into their roles, So if we are not supporting them to do what they want to do and to do what they do best, then that's not going to be an organisation that is going to retain its staff. So, and it's also linked to the earlier conversation around education. So the thing for me around what am I as the chief executive? That's probably the best way to do it. What am I as the chief executive doing to make sure that we retain staff? And the first thing that I am trying to do is to be present and visible, and to demonstrate to colleagues across the system that I have a job to do like everybody else, and I care about the people that work in this organisation, really care actually. And therefore, one of the things that's tangible is to understand how people experience their work, so that we can know where we're doing it well, so that we know where we're not doing it well, and we can improve people's experience when they work in Grampian. And you'll hear me speak about culture quite a lot. You'll have heard, I would imagine, of the I Matter surveys, and that does go some way to giving us some data about what's good and what's not about working in this organisation. But very soon, I think on the 14th of February, we are launching a new culture survey, and that goes into a lot more detail. And so what I would ask of colleagues is, if you're part of that survey, please participate in it. That will tell us where we're getting it right and where we're getting it wrong. That will allow us to make improvements to how you experience work. And that is the biggest overarching piece of strategic work that I am focused on just now to improve the experience of colleagues working in Grampian. Just quickly then about other things, MACA, short-term contracts on the bank and agencies, people coming out with Grampian. So NHS Grampian has led the way on international recruitment, undoubtedly. And the rest of Scotland is now moving to look at and deliver international recruitment. We've had really good success and continue to do so under the leadership of Jane Ewan and the team around that. So that's a live example. MACA are here with us for a very short period of time. Very grateful to our military colleagues for the support they've given. That's a very short period of time, I think 4 to 8 weeks. June Brown, our Executive Nurse Director, is currently negotiating that. In fact, I think there was a site visit yesterday. Absolutely, we are out to try and get temporary contracts with bank and agency for periods of time, and that's a constant piece of work. So I think there are many different things. If there's a specific area of focus that we would like to go into, it might be an idea, as I said earlier, to get Tom to come along. And the biggest thing that I think I and everybody hopefully watching this can do to retain staff is to think about how we make people feel when we interact with them at work.
Thank you, Caroline. I think that session would sound, well, even for me personally, it would sound something that I'd be interested in seeing. The next one follows on from that. I don't think you'll have had the chance to see it, but last night, attached to the Daily Brief, there was a letter to us from Power, in which he outlined how the workforce cell are looking at possibly expanding the deployment of staff from non-essential services to help provide more temporary support where they're needed. Just wondered, this is kind of more from me than a submitted question, but I wondered if you could tell us a little bit more about those plans, because I think there probably is a little bit of concern when people hear about being deployed elsewhere.
Yeah, so I haven't seen that letter, Mike, but happy to share my views on it. Before I do that, I am just going to check. Can you hear Scottish Gas drilling outside my house now, if you're wondering what that noise is?
We can hear it a little bit, but between Ollie and Scottish Gas, it's going very smoothly.
Yeah, brilliant. A day in the life. So I think that so absolutely, as people will know and recognise, in a normal winter, which this is not, this is a a very demanding winter, and that is on the back of 2 years of significant demand across health and care. We open additional capacity to manage the demand from the Grampian population. On top of that, we've also had to plan for the Omicron wave, which I hope the modelling this week is certainly demonstrating that it's levelling off. It's levelling off at a level higher than most of us would like, but it is levelling off rather than continuing to rise, which is positive. So we need to, and I think I touched on this again last week in the first Q&A around, it is just a matter of fact that we have to have capacity that meets the demand of the population, and in winter that increases. What's been particularly challenging is that people have been deployed from their substantive roles for longer than winter. That's been going on now since the start of the pandemic to different degrees. So I would imagine, and I would hope, that the intention of the letter was to try and communicate what we're doing. Deployment is the last thing that we want to do. And last time when we spoke, Mike, you asked about, or one of our, I think it was our associate practice educators, spoke about how frustrated they were that we'd gone out to ask for volunteers. And I explained that was because if we don't manage to identify colleagues to work in service in additional areas, additional wards, through volunteering, then we'll need to move to deployment. So it's something that none of us want to do, because we recognise the importance of staying with your team and doing what you come in to do in the job that you do. However, we absolutely have a responsibility to deliver critical services, and our workforce is, as I said in the previous session, a rate limiting factor around that. So I think it's really important that we make sure our communication is thoughtful, is empathetic, and acknowledges just how difficult this is. And it is difficult, and there isn't a nice answer to that says we don't need to deploy staff into different areas, because we need to be able to continue to deliver services. But I am really, really conscious, as our colleagues that will have constructed the letter, of the impact that has on people, and I don't want to diminish that, because it is really hard.
Yeah, and I think the letter was really well written, and it did offer reassurance. It talked around teams potentially being deployed alongside their existing colleagues. Various things like that. It's just, obviously, when we talk about deployment, it's something that isn't a comfortable thing for people to hear. So I thought it was maybe worth just bringing it up today, and that's good to hear your answer on that. The next one is more of a concern than, I guess, a specific question. They've said they're concerned that recently a number of staff secondments have been filled without being fully advertised or otherwise circulated internally. I think that's because in these examples they've needed to be filled at very short notice. They feel, though, that this isn't fair on our existing staff, and that they would like to know if there's anything that you can do as Chief Executive to ensure that opportunities within the NHS and the 3 partnerships are more widely seen.
Yeah, so Mike, we've obviously got policies around very clear policies, I think, around how secondments and temporary contracts and different ways of working should be undertaken. So I'm not going to comment on individual cases. We would need to understand, which I'm happy to do if there's specific concerns around individual cases. I wonder, however, that there are other times when people, because of the area of risk that's held in that area, the level of risk that's held in that area, or the speed at which something needs to happen, particularly just now when we remain on an emergency footing, whether or not the decisions are made to move staff rather than to have secondments. I don't know if that's possibly causing some confusion, but again, there are very clear policies on it. If they're not being adhered to, then the cases that there are concern about, please let me know, and specifically this one, and speak to your line manager around understanding why that happened. But it definitely should not be consistently and frequently shouldn't be happening at all, but it shouldn't be happening consistently. So if there's something not quite right, then let's try and understand in a bit more detail what it is.
Yeah, the person did actually give a couple of examples that I could share with you. I just didn't want to share them in fairness on the broadcast just now. So the final question, it comes from an anonymous advanced nurse practitioner who asks why, given the staffing shortages in Grampian, particularly with experienced staff, and with the push to get retired staff to come back into the organisation, why sick pay starts from scratch if you've been out of the NHS for over 12 months. They also mentioned that they believe that even working in a GP practice is counted as working outside of the NHS.
So I'm sorry, this is not going to be the answer that I'm sure our anonymous ANP colleague would like to hear. We're completely bound by national T's and C's, and the legislation and the frameworks that sit behind that would be what would tell us why that is the case. But yeah, that's our T's and C's are agreed nationally and debated nationally. And if there's something that we as NHS Grampian should be contributing into those national conversations, then Tom Power, our Director of People and Culture, can do that through his professional network, which works across Scotland and with the government. So if there's specific concerns around that, then let's understand them and feed that in. But yeah, that's the public sector NHS Scotland T's and C's position.
Thanks, Caroline. Okay, just to finish off then, I'd just like to thank everybody and yourself, Caroline, for this time. I would reiterate that we're really keen to hear feedback as we were after the last one, and to refine how we do this in future. People did say they wanted it to us to continue the rough and ready approach, and we've had Ollie and Scottish Cats. Indeed, yes. But yeah, and then on another note, just to also say to people, could you feel free to submit your questions. Remember, as Caroline said the last time, there's no such thing as a daft question. We're happy to hear them all. And then finally, I also wanted to just take this chance to highlight for people who haven't seen it. Caroline did the first in a series of In Conversation videos last week with Helen Spark, one of the practice educators who submitted a question last time. I really enjoyed watching that and thought it was really quite a thought-provoking video. So if you haven't seen it, you should go and check that out. I'll stick a link in the description below the video. And thank you again for watching, and thank you everyone for your time.
Thanks, Mike.